All right, the doctor's in the house right now. Lisa Breck is over there talking to Dr. Ahluwalia about the FDA and what they're up to here.
Yeah, well, there is something really scary going on. I'm sure a lot of you get prescriptions online and you think it's safe, but the Food and Drug Administration is sending out a warning that the majority of the internet pharmacies are fraudulent and likely selling counterfeit drugs that could hurt them. And we're talking crazy stuff, right, Dr. Ahluwalia?
So, you know, the problem is we think we can find all the deals online, right? But there are certain things that we need from trusted sources. And one of them is our drugs. I mean, medicines, right? And so what has happened is that more and more people have gone finding deals, and they have started buying things from pharmacies that are not registered. We don't know anything about these pharmacies. They're overseas. There's no guidance, no regulation. So we think we're getting counterfeit drugs, drugs that have nothing in them, and sometimes even harmful substances.
I was reading like even toxic substances like arsenic and rat poison in some of them could be because they're not being regulated?
Correct, because they're not being made with the stringent standards that we want, right? If you just make it in a bin somewhere and there's some waste there, who knows? We have no standards.
Okay, and only like 3% of the pharmacies out there are following our standards.
Exactly, and the problem is...
And this, again, online pharmacies.
Correct, and the problem is, like, your doctor gives you a medicine, right? And you go back and you say, oh, you know, check my blood pressure, and it's still elevated. Your doctor assumes that you took the right medicine and it isn't working, and he's going to change you over to something else which may not be as effective or may have other side effects. So it's really a bad thing.
So how can you tell if the online pharmacy, should you use them at all? And if you are going to use them, how can you tell you're using the right one?
Right, so the FDA has made this new push to educate our customers and to let them know. So number one, your pharmacy should require a prescription from your doctor. Any pharmacy that says that, you know, we don't need a prescription or our doctors can just talk to you and give you a prescription, that's not right, okay? The second thing is if the deal is too good, it's probably not right. And finally, I think that if you go on the FDA website, they have a list of all the pharmacies that are listed by your state board, by the federal board, you know, just make sure.
That.
Yeah, exactly, just make sure.
The next one is something that affects so many people because we all know we have grandparents or parents who are getting older and maybe driving might become an issue. And it's like, when do you know to take those keys away from someone you know?
Well, it's a big problem, right? Because if you take those keys away, they lose their independence. And that's a big problem.
Oh, it's huge.
Right? So you really don't want to do it when they're not, you know, there. And the problem is for the doctors, like there's no real rules or laws or anything like that. But, you know, if somebody has, you know, severe Alzheimer's disease, if they don't have the spatial kind of recognition, if they're not able to walk properly, these are problems. And in California, we are required to report it to let the licensing boards know that these people are not safe to drive. But that's not true in most states. And so the problem is that, you know, people are driving that are unsafe and their families are just not able to tell them not to drive.
And the thing is I also read that when doctors often tell their patients, I think you maybe should stop driving, it comes back to bite them, right? A lot of them end up losing their patients.
Yes. So, you know, they did the study in Canada where they looked at 100,000 patients, and apparently in Canada, they pay the doctors a small fee to report. So they followed all these people, and they realized that once the doctor gets involved and warns a patient or tells them that you really got to be careful, that their accident rate goes down. So I think we need to get involved more instead of just being on the sidelines.
Dr. Ahluwalia, thanks so much. And Maria, if you want, you can go ahead and take his keys away. I'm just saying. Just take his keys. Just grab them. They're usually right there on the set. Just grab them. Yeah, there you go. There you go, Maria.
You never know.